So this was I'm in class right now, a nursing leadership class, which is one of my final nursing courses. And one of that is to do a community awareness project regarding a health promotion idea. So my topic that I chose was pulmonary hypertension. And the reason I chose that is that is something that I've been diagnosed with in the last year or so. So I didn't know anything about it, and I feel like I'm in the medical field and I don't know anything about it. Nobody seems to know anything about it. So that's why I chose that. And then I reached out to Abby thinking, well, maybe she'd let me present to her. She's an employee health person. And then I thought she's invited you all too, so if you don't mind.
No, not at all.
Okay. So I'll just give you kind of like a layman's version of it, I guess, because I know you guys aren't clinical people. My ultimate goal after school, I do have a passion for it, is to create a support group locally, because there is no support groups in this area or where I live, and I live an hour north of here. So that's my plan down the road.
I might have a funding source for you.
You do?
The Hodge Run raises money for pulmonary
Oh, fibrosis?
rehab.
Oh, good. So sorry for this, it's hard to see, and I didn't make a printout for you girls because I thought, that's all right though. But pulmonary, just as a definition, because to explain what it is, people think pulmonary hypertension, they think high blood pressure because of the hypertension language. And it is a sort of high blood pressure, but it's in the arteries directly to the lungs. It's a serious condition. The blood vessels that carry blood from the heart to the lungs become hard and narrow. And then the heart has to work extra hard to get that blood pumped through to the lungs. It's a chronic and incurable disease, but there is some treatment that can help the symptoms. This is just a picture, and I'll show you what it means. Just to give you an example of a pulmonary hypertension, heart and lungs, and a normal. It's kind of hard to see, but notice how narrow this is compared to that is, how those vessels are. Also the right side of the heart also enlarges as it tries to pump harder to that side. So that's just an example. Symptoms of PAH are pretty vague. I mean, nobody's going to stand right out until it's really severe. Short of breath during routine activities, such as even just climbing stairs, tiredness, dizziness, fainting, chest pain, racing heartbeat, pain in the upper right side of the belly, a decreased appetite, and fluid retention, so swelling of the arms, legs, or abdomen. And that's how I feel sometimes. Poor guy. And I just threw this out here because the World Health Organization did create a classification system of diagnosing. So 1 through 4, and 1 is obviously no limitation, all the way to 4, where it's people are unable to perform physical activity even at rest. Let's see if I have any other notes on that. And then the symptoms that I mentioned before get worse and worse with each classification. This is kind of hard to see, but this is kind of correlating survival rates with the class that was just before you. So class 1 and 2 is a survival rate without treatment of 6 years. Class 3 is 2.5, and class 4 is 0.5 years without any treatment. Just some verbiage again on what pulmonary hypertension, they do categorize it as idiopathic, meaning they don't know what causes it, or there may be a family history, or it's associated with various conditions such as HIV, liver cirrhosis, autoimmune disease, congenital heart diseases, all of which are prevalent around the world, and it contributes directly to disability and early mortality. I went to my family doctor a few weeks ago, and the nurse checking me in, young girl, said she saw that I had it. She had just been diagnosed with it because she has scleroderma. So that's an autoimmune disease. I have a congenital heart defect that I found out. I won't go through all this, it's kind of hard to read. But as I mentioned before, there is no cure. There are different treatment options. They do use medications, which are like a vasodilator to dilate the blood vessels. They've just become FDA approved. I didn't put them out there because the names, because I don't think that's pertinent to know any of that, but just knowing that there are medications, diuretics to help with the swelling, blood thinners, because people can also get clotting in the lungs from this, surgical procedures, an atrial septostomy. I had to look that up. That's actually where they go up like a heart cath into the heart and create a hole between the two chambers to open that pressure in that right side that's struggling. Otherwise, the only other really true treatments is a lung transplant or a heart-lung transplant. Those are the only, I guess, cures, I guess wish you could say, even though there isn't either.
The other passion of this person that raises this money for us is transplant.
Oh, good.
Because her husband had to get out
Had to get a lung transplant. Huh. Yeah, and oxygen therapy and regular physical activity, and that's where I see where Bay Area can be involved too, because I was talking to respiratory therapy, because in order for a patient to qualify for home oxygen, they have to do like a 6-minute exercise test or certain tests, and for someone who might be severe, that might be really difficult to do. Obviously, they'd qualify then. But that's one thing we do offer here, and also we have physical rehab here. But not, I don't think we have rehab programs that pertain directly to respiratory rehab. So again, one of the key things too is preventing and treating respiratory illness, immunizing every year for influenza and every 5 years for pneumonia. Just some other factorials: 95 to 2002, 1.9 million patients were hospitalized with PH in the U.S., and 117,000 deaths were attributed. And in the U.S. alone, 300 new cases are estimated to be diagnosed every year, and the greatest number are in women between ages of 21 and 40. And then just the cost of treatment, and that more so the 244,000 correlates with the newer FDA drugs per year. So it is very high expenditure for a person's, and hospital readmission rates are also very high for this group of people. They call it the invisible disease because most doctors don't look for it. It's not something that stands out, as the symptoms I showed you were pretty vague. A lot of people could have those for various reasons. They're usually misdiagnosed with asthma or COPD, or just being assumed that they're obese, or it could be sleep apnea related. So many patients go undiagnosed or misdiagnosed for years, and it is a slow development and progression. There are no early signs or symptoms. So I do have just a quick little video, if you don't mind I show you that. If I can open it. Nope. That's okay.
That might be because it
Yeah.
clicked to some other place on you.
That's okay. What it is there is a campaign out there by the Pulmonary Hypertension Association group where they're pushing for providers and doctors to learn how to look at the obvious and think outside the box of what you might assume that is. You know, even though they might have an irregular heart rate or sleep apnea, look at what's causing that. So that's what they're trying to get out there, is an early detection, early diagnosis campaign. Other diagnostic tests and procedures are an echocardiogram, chest x-ray, EKG, pulmonary function test, and perfusion lung scan. Right now, the golden standard, though, for diagnosis is a right heart cath. My understanding is we do all of these testing here also. The right heart cath, Nicole Swanson told me, oh yeah, it's easy peasy, it's quick in and out, and I'm like, it's a heart cath. But, you know, I guess in her world that seems pretty simple because that's what she does. To me, I don't think so. But it is the only test that can truly measure the pressures of those blood vessels to see how severe the pulmonary hypertension disease is. People with PH or pulmonary hypertension live a normal life as much as possible until symptoms become severe enough where it's exhaustive and they're in that category 4 level. But they're instructed to follow the same health measures as any other person, eat healthy, don't smoke, get plenty of rest. Pregnancy is definitely not advised, so you saw that this group of women that are most diagnosed are 21 to 40, which is pretty much in childbearing age. So that could be also a devastating thing. And then the patient and the family need to stay informed. Family is really important to keep informed and to be supportive, and they actually offer booklets and information on how caregivers can be supportive. And that was it. I breezed through that.